connected to my heel bone. My heel bone's connected to my ankle bone. That's how we connected those dry bones.
What a great memory of one of my first anatomy lessons. How about you? Did you remember that one? So with the integument system, we have begun the study of the systems of the body, which is simply one approach. Another approach to learning anatomy is learning regional anatomy, which makes sense from a dissection and a clinical perspective. I had the advantage of learning anatomy and physiology from many viewpoints, including gross anatomy through dissection, microscopic anatomy, developmental anatomy, and regional anatomy, as well as pathology. What we are trying to do in this course is learn all of these things from one point of view, and that is through studying systems. And this point of view can be somewhat limiting. True understanding will only come from repetitive use of this information throughout your career. We will now begin our study of the skeletal system. The skeletal system includes the bones, cartilages, and joint structures that come together to perform the main functions of the system. And some of those functions include bringing support to the body, protection, movement, blood cell formation, mineral and growth factor storage, and hormone production. Chapter 6 begins the study of the skeleton by first looking at cartilage. The reason for this is that all bone begins in the fetus on either a cartilaginous or fibrous framework. In part 2 of this video, we will see exactly how that occurs. Let us recall that mesenchyme, which is an embryonic tissue, differentiates into the connective tissues of the body, and mesenchyme is derived from the middle germ layer known as the mesoderm. Cartilage contains cells and extracellular matrix. The extracellular matrix is composed of ground substance and tightly bound fibers. The ground substance in cartilage is composed mainly of water and 3 large molecules: glycosaminoglycans, chondroitin sulfate, and hyaluronic acid. Up to 80% of the ground substance is water, which gives cartilage its resiliency. The cells of immature and growing cartilage are called chondroblasts. In mature cartilage, the cells are encased within their own matrix, within cavities called lacunae. These cells are referred to as chondrocytes. Here's an image of growing cartilage with mitotically active chondroblasts stacked up like coins. Cartilage is avascular and devoid of nerves. Therefore, cartilage that is damaged takes a long time to heal and may never recover fully. Aging and damaged cartilage will very often calcify and eventually break. Here we can see an example of damage to cartilage on this arthroscopic image. Surrounding cartilage is a layer of dense irregular connective tissue called the perichondrium. Peri means around and chondro refers to cartilage. The perichondrium adds stability and contains blood vessels which nourish the cartilage. A cellular layer of the perichondrium contains the immature chondroblasts that can undergo mitosis during times of growth. The 3 types of cartilage are hyaline, elastic, and fibrocartilage. Let us begin with hyaline cartilage, which is the most abundant type and is the cartilage that lays the framework for much of the bone that is eventually laid down in the human body. As you can see in this picture taken from your textbook, the hyaline cartilage, which is shown in blue, can be found in many of the joints throughout the body, makes up part of the rib cage, makes up part of the larynx and the trachea, and is found in the nose. Hyaline cartilage makes up the joint surfaces in all synovial joints and is an essential component for effective and smooth joint movement. Hyaline cartilage is also the beginning framework for most of the bones of our bodies. We will revisit hyaline cartilage when we learn about joints in Chapter 8. Just a couple of words about the other 2 types of cartilage. The main difference between the 2 is the predominance of the fiber type. In fibrocartilage, it's collagen, and in elastic cartilage, it's the elastic fibers. We find fibrocartilage in between vertebrae as the intervertebral discs and within synovial joints as menisci. Elastic cartilage is found only at two locations in the body, the pinna of the ear and the epiglottis. Looking at a picture that I borrowed from Chapter 7, we can see the distinction between the axial skeleton shown in green and the rest of the bones making the appendicular skeleton. We will now take a look at the bone structure, beginning with gross anatomy and ending this video with microscopic anatomy. There are two types of bone that make up the whole bone: the outer, more dense, compact bone, and the inner, lighter, honeycomb-like spongy bone. Spongy bone contains spicules of bone called trabeculae, and it is within the spaces of the trabeculae of bone where we find bone marrow. Bones come in all different shapes and sizes, the classifications of which are unimportant for our needs. We will, however, describe the structure of a typical long bone. The parts of a long bone include the shaft, known as the diaphysis, with two expanded ends called the epiphysis. Looking at the diaphysis more closely, we see the outer collar of compact bone and an inner medullary cavity which is lined with spongy bone. There is an outer membrane called the periosteum and an inner membrane called the endosteum. Osteo refers to bone. Here is another picture of a long bone. This one is the femur, and it shows the difference between a live specimen and a dried specimen. Notice the yellow marrow within the medullary cavity of the majority of the bone, and the red marrow in the proximal epiphysis. Red marrow is known as hematopoietic tissue and is a site of blood cell production. In the infant, red marrow is found throughout the skeleton. However, the majority of it is replaced with fatty yellow marrow in the adult. This picture shows the limited areas where red bone marrow exists in the adult. During times of anemia, however, yellow bone marrow can revert back to red. Our final topic for this video is microscopic anatomy. We will begin this section with the 4 cells of the bone. Take some time to read about these 4 cells on your own, and we will be looking at them more closely together in class. Take the last couple of minutes of this video to give you a tour of some of the microscopic anatomy of bone. So let's start with this great picture from your textbook, and we're going to work our way from outside in. And we start off with the outer membrane called the periosteum, and then we work in more deeply, and we can see these parallel arrangement of lamella of bone. Lamella means thin, plate-like, and they're actually called circumferential lamella. And then deep to that we have the concentric rings of the organized systems called the Haversian system, or also known as the Osteon. Within the center of the Haversian system we have what's called a central canal, and within the central canal we have an artery, a vein, and a nerve. And deep to that we have the trabeculae of spongy bone, and then lining the spongy bone we have endosteum, and then we have the medullary cavity. Taking a look at a higher magnification, we're going to be looking at one osteon now. Starting at the central canal, we can see the artery, the vein, and the nerve. And we can also see the concentric rings, the concentric lamella of bone. And living in between the lamella, we see the residence of bone, the osteocytes. Now the osteocytes are spider-like in shape. They have these extensions, and they actually communicate with each other by touching each other. and those extensions are within these little canals called canaliculi. And that'll do it for part 1 of chapter 6. Part 2 will cover the second half of the chapter. I'll see you in class.